All right, today we're tackling a really big one, vertigo. That sudden, completely disorienting feeling that the world is spinning totally out of control. It's a surprisingly common condition, but it's also really misunderstood. So let's kind of get our balance here and figure out what is really going on.
I mean, it is just a deeply unsettling feeling, isn't it? One moment, everything's fine, and the next, bam. It feels like you're on a merry-go-round that you just can't get off of. If that sounds even remotely familiar, then you know exactly what we're talking about.
Okay, so let's get our bearings and be really clear about what we're talking about. Vertigo is not just general dizziness. No, it's a specific and false sensation that you, or the room around you, is moving, usually spinning. And the culprit? Well, it's almost always a problem in your body's balance headquarters, what's called the vestibular system.
Now, to really understand vertigo, you have to figure out where the problem is starting. And you can think of this like a critical fork in the road, because where it starts changes absolutely everything that comes after. Yep, that's right. That spinning sensation, it pretty much always starts in one of two places. If the problem is in the delicate little structures of your inner ear, we call that peripheral vertigo. But if the issue is coming from within the central nervous system, we're talking the brain or the brain stem, that's known as central vertigo. And what's so fascinating is that the symptoms themselves are like little clues pointing down one path or the other. As you can see, peripheral vertigo, the inner ear kind, often causes this really intense spinning. And sometimes it can even mess with your hearing. Central vertigo, on the other hand, is usually a bit milder, but can come with other neurological red flags. Doctors will even look for something called nystagmus, which is just this involuntary movement of the eyes, because the direction they're moving can literally point to the source of the whole problem. Okay, so let's talk about the usual suspects on that peripheral path. The biggest one, by far, is something called BPV. I know, it's a mouthful. It stands for benign paroxysmal positional vertigo. But what it really means is that tiny calcium crystals have gotten knocked loose in your inner ear. Just imagine tiny little rocks rolling around where they don't belong, sending all these wacky, false motion signals up to your brain. Then you've got vestibular neuritis, which is an inflammation of the balance nerve, and Meniere's disease, a chronic issue with fluid in the inner ear. Now, when we look at the central path, the causes are, well, they're a whole different ballgame, and usually much more serious. Here, the vertigo isn't the main problem. It's a symptom of something bigger going on, like a stroke, multiple sclerosis, or something called a vestibular migraine. And this is exactly why telling those two paths apart is so critical. Okay, so we've got these two very different paths. How in the world do doctors figure out which one is the right one? Well, like we said, this is where the real detective work kicks in.
Yeah, this isn't a guessing game at all. It's a very specific, investigative process. Clinicians gather evidence from your story, from physical exams, and from targeted tests to really zero in on where that vertigo is coming from. And this process you see here really lays it all out. First up, it's all about your story. What triggers it? How long does it last? What does it feel like? Next up are the physical tests, where a doctor might actually try to provoke the symptoms just to see what happens in real time. From there, you might get specialized hearing and balance tests for more data. And if there's any suspicion of a central cause, an MRI can give a direct look inside the brain. And let's zoom in on one of those key physical tests for a second, the Dix-Hallpike maneuver. This is where a doctor carefully moves your head in a specific way to see if it triggers the vertigo and those telltale eye movements we mentioned. It's a pretty simple test, but it's incredibly powerful for diagnosing BPV, often right there in the office. All right, so once the detective work is over and there's a diagnosis, we can finally open up the toolkit. And the great news is there are some really effective treatments out there, each one tailored to the specific cause. So for BPPV, which again is the most common cause, the treatment is, believe it or not, surprisingly simple and totally mechanical. We're not talking about pills here, we're talking about physical maneuvers, like the famous Epley maneuver. The whole goal is to use gravity to gently guide those loose inner ear crystals back to where they're supposed to be. But what about for vestibular neuritis? Well, that's a different approach. You might see corticosteroids used early on to knock down that inflammation. And that's often followed by a special kind of physical therapy designed to help your brain adapt and compensate for the faulty balance signals it's getting. Now, for a chronic condition like Meniere's disease, the game really changes. It's all about long-term management and finding a new kind of normal. This usually involves lifestyle changes, things like a low-salt diet and diuretics, to help manage the fluid pressure inside the inner ear, and hopefully reduce how often and how severe the attacks are.
A huge tool in the kit for a lot of these conditions is something called vestibular rehabilitation. And the best way to think about it is like physical therapy, but for your brain. It uses really specific exercises for your eyes, your balance, and your walk to help your brain relearn how to process everything and tune out those confusing vertigo signals. And this brings us to central vertigo, and this is absolutely the most crucial point. The treatment isn't really for the vertigo. It's all about treating the underlying neurological problem. Whether that's stroke recovery, managing multiple sclerosis, or treating vestibular migraines, the primary goal is to address the root cause in the brain. So, with all these different paths and all these tools in the toolkit, what does the future actually look like for someone dealing with vertigo? Let's take a look out at the horizon. This right here is a fantastic at-a-glance summary. For the most common one, BPV, the outlook is excellent. It often gets better super quickly with those maneuvers. For something like vestibular neuritis, it's more of a journey, recovery over weeks or maybe months. And for those chronic or central conditions, it's all about managing the underlying disease. So if there's one thing you take away from all of this, let it be this. Vertigo might feel chaotic and mysterious, but it's not. The sensation itself is incredibly disorienting, for sure. But the medical approach to it is structured and logical. For most people, there is a clear diagnostic path that leads to a really effective solution. There is a way out of the spin. And that really leaves us with a final thought to chew on: our sense of balance. It's something almost all of us take completely for granted, right up until the moment it's gone. By understanding this incredibly complex system, we're not just learning about a medical condition, we're actually learning how to listen to our own bodies a little bit better and maybe become stronger advocates for our own health.